So diversity in care basically started because we wanted to, or I wanted to fill a void. There was an erosion of frontline services. Most of the drop-in centres, night shells, fast-track housing services were being closed down, but more importantly, there was an erosion of services for women. There was very little to begin with, but even the drop-in services that had special days or nights for women to attend, those women that are most vulnerable and most at risk, those were being closed down because most of those services were in prime locations. The government came in. It was all about buying property in prime land. So a lot of those places were closed down and sold off. Um, and what we're now left with is a number of really vulnerable people, men and women and young people, that are struggling to find somewhere to live. The most vulnerable people are now having to go through the housing option system, which sometimes could take 3 months, which sometimes could take weeks and days. But if you have somebody who's at risk and they're wanting to deal with their addiction, or somebody who's at risk of using or being found by their pimps, going down to housing, filling out forms, waiting for a space to come up and going through that whole procedure just takes a hell of a long time, and it leaves that person vulnerable. So the system usually loses them halfway through. It's just like somebody who says, okay, I'm ready to stop using drugs now. I don't want to do this anymore. I want to get into rehab. Then they have to wait for the referral to go through to see if funding's available. And if they're not signed up with their GP, they're not able to get that service. So by the time anything is offered, if at all, it can take up to 6 months. That person is long gone. Housing options for these people are quite limited, because we're talking about people who not only have a drug and alcohol issues. There's a lot of trauma. People don't just get up one day and decide I'm going to use drugs and wreck my life. There is a lot of trauma that's gone on before, especially with women. We find most of the women that we're working with, there's been sexual abuse, physical abuse, and if not, then there's the whole sexual exploitation as a means to feed their drug habit. And that has a devastating effect on people's self-esteem. A lot of women as well who have a drug and alcohol issue, which is seen as chaotic, usually end up in the criminal justice system. Their children are taken away. It's been very difficult. We've been more successful with getting our male clients into housing, um, because the male clients don't have those ties and those issues that the women have. So we have had more success in getting the men rehoused privately or through the council. We're developing our connections with housing associations, and we do want more housing associations to work with us. The women that we're working with, we need to get those women to a stage of being pretty self-sufficient, especially around education, developing their skills, and getting them to a position where if there is any semi-independent or independent housing, they'd be able to sustain that tenancy agreement. What we're finding is that the women that we have gone to the council with, after they've completed and they're doing extremely well, some of them have got work part-time, they're then being placed into a B&B. After we've worked very closely with the councils, they put them back into a B&B, and the condition of the B&B is far more sinister than anything we could have provided. So it's all that hard work that's been done, and now it's gone down the drain basically. And with less and less landlords and private landlords now wanting to lease their properties to people that are still in receipt of benefits, it's now become quite dire. Already we're seeing some of our women that are on ESA, because they're on a drug program as well as having mental health issues. They're being assessed a lot more harshly. So on the surface, these women look like they're doing very well, but there are deep entrenched issues, which means they can be overcome by the day-to-day routines that we take for granted. They find it very difficult sometimes to get up and motivate themselves. And not only that, they have a very low self-esteem issue and feel that they're being penalised by everyday people that are going about their business. So it has to be a gradual process, which I think the cuts to the benefit system now and the way people are being assessed is going to do a lot more damage than good. We're also getting more and more referrals for people under the age of 25. And these are young people who, again, have had a very traumatic start in their life, who cannot cope without support with college, university, much less get a job. So more recently, the government's saying that they're going to introduce a 30-hour a week volunteers program for young people who are unemployed. For the average unemployed person who's just lazy and don't want to get up and go to work, that will work well for them. It'd be a good kick up the bum. But for somebody who is going home to abuse and trauma, or have had parents who are extremely dysfunctional because of their drug and alcoholism, or those young people who have mental health issues, I really don't know how they're going to cope. And if charities like Diversity in Care can support them, or even Centrepoint can support them, then that would be great. But we're really not sure where the funding's going to come from at this stage. This government that's come in now is talking about stopping housing benefit for people under the age of 25, and I just don't understand how you can be thinking that way for the people who don't have a family to support them, or don't come from a stable family background. How are they going to cope? What we're seeing in the last 5 years is a lot of documentaries and a lot of quips in the papers that sensationalize poverty and the most vulnerable people, and it's got the ordinary person thinking, well, they brought it on themselves, I didn't tell them to take drugs, it's up to them, and if you're homeless it's because you're a bum, etc. And really that isn't the case with a lot of people. I can say that working for 30 years in the sector, the trauma that the most vulnerable people go through is no different. It's just that there's more of them. So obviously something is going wrong at central government level. And central government are interested in the economy, which is fine. But we need to also show a bit of compassion for people who don't recover so quickly from distress and trauma, and those who don't cope very well with what life has meted out to them.